So hello everyone, thanks for coming to this information session. So I'm going to talk to you today about digital health program at the University of Otago. So just first of all, just a bit of background about me. I'm a medical doctor. I've got clinical experience in NHS in the UK and in New Zealand. And I've specialised in clinical informatics or digital health. So I've worked in digital health for most of my career, working on IT projects in New Zealand, UK, Kenya and Vietnam. I'm a fellow of the UK Faculty of Clinical Informatics, which is an association for academics and clinicians who specialise in digital health. I've also got an executive MBA from the University of Auckland, and I also work part-time for the University of Oxford for my projects in Kenya and Vietnam. So my research interests in digital health are in global health, also in usability, and also doing work with virtual reality for training healthcare professionals. So if you have any questions as we go along, feel free to put on your mic and ask them, or you can type them into the chat and I'll come to them at the end. Okay, so just a bit of background about what digital health is. So digital health is about the use of digital technologies to improve healthcare. And so it covers a huge kind of range of things. But some of the things that you might have seen in the news or you might have heard about digital health are things like telemedicine, where doctors and healthcare professionals use video conferencing, a bit like we're doing now, to talk to patients. Artificial intelligence, which is where the computers are helping clinicians make decisions. So it might be that they're analysing CT scans or radiology images and can detect if there's a disease process there, just the computer on its own, and then helping the doctor to make clinical decisions. Also about wearable sensors. So these are things that people can wear, a bit like Fitbits and things like that, that can track your movement and pick up your signs of your heart rate and things like that. And also more kind of routinely used systems such as electronic health records. So electronic health records are the kind of digital version of medical records that are used in doctors' clinics and hospitals. So over the last few years, digital health has been growing quite rapidly. So you might have seen in New Zealand, there's recently been quite an increase in the budget attached to data and digital, but also in the private sector. And over the course of the pandemic, there's been a huge investment in new companies addressing digital health challenges. And this graph on the right shows that there's over $14 billion invested in digital health funding last year. But you don't have to take my word for it. One of our guest lecturers on the course is Shane Hunter, who's the Deputy Director General for Data and Digital at the Ministry of Health in New Zealand. And he gave us a great lecture about the work that they're doing, but also is really passionate about growing the next generation of digital health experts, and has been very supportive of us as we're trying to train clinicians and people from IT backgrounds and other backgrounds in digital health. We also include on the course people from the digital health private sector, so people who've been setting up companies or involved in digital health outside the government sector. So an example of this is Dr. Angela Lim, who is a junior doctor based in New Zealand, who set up a new company called Clearhead to help people with mental health challenges. And she's very passionate about the way that technology can address and change health systems and how that's going to happen over the next few years. And we also have Dr. Will Reedy, who's a medical doctor, but also now Chief Executive Officer of Spark Health, which is a major digital health company in New Zealand. And he's very passionate about the new technologies on the horizon. So things like artificial intelligence and machine learning, and how we can really use things like telehealth to engage people in their own healthcare. So, excuse me. So, what does the programme consist of? So we've got two qualifications at the moment. One is a postgraduate certificate. This takes place over 6 months, starting from next year, and is based on 2 papers, and I'll just talk about those in a second. And the other qualification is the postgraduate diploma, which takes place over 12 months, which includes the papers from the postgraduate certificate, but then also has additional papers that you can take as well. So this is the postgraduate certificate in digital health. So the 2 papers are 701 and 703. So 701 is Principles of Digital Health and Informatics, which is the 30-point paper. And 703 is Digital Health Technologies and Systems. And so the Principles of Digital Health and Informatics give you kind of a baseline about what digital health is all about, the different types of information systems used in healthcare, the kind of international standards and terminologies and things like that that are used for sharing data within healthcare. And we also have a lot of guest lecturers from the sector come in, talk about all the different projects that people have been involved in, and cover quite a lot of detail about the basic principles of informatics. And then in 703, it's much more practical paper. So the students split into groups and they work on a challenge. This year, we've been working on the challenge of COVID vaccination and certification. So the teams have been working together to go through that kind of design process of how you think about who your digital health project is going to be aimed at, and then iterating through with designs and prototypes to come up with something that they can think would be useful as a digital health project. And we cover, in that paper, we cover a lot about what you need to do in order to get a digital health project into the hands of people in terms of regulation and who you need to, how you need to get funding and things like that. So the postgraduate diploma then builds on those 2 initial papers, and so it takes place in the semester 2 next year, and then you can choose from a selection of papers that are on offer, and you choose you can choose 2 papers out of this, out of 706 and 707. So 706 is Research Methods for Digital Health, which is a 30-point paper, and that covers how you would do research on digital health. And 707 is about digital health information governance and ethics. And then we have 2 papers that are 15-point papers. So these you could consider as one paper together in terms of your options of how you would choose. And those are on patient-centered digital health, which is about digital health technologies that help patients engage with the health service. So things like telemedicine and self-monitoring and that kind of thing. And then we also talk about emerging technologies in digital health. So these are the things like AI and virtual reality and new technologies. So yeah, so you can choose 2 30 points. You can choose up to 60 points out of the 90 points available. And you also can potentially swap the research methods in digital health for another paper that we have on offer within the information science department. Okay, so how do we teach? So we use Microsoft Teams for teaching. So sometimes when you do online courses, you have to log into lots of different systems and it gets a bit complicated and difficult. So we just use one system, which is Microsoft Teams, and you'll be given an account when you enroll with the university, and it works with your whole Microsoft 365 account. So your Word and Excel and things are all linked into the same user account. So we deliver live lectures. So it's not just watching recordings of lectures. We have live lectures like this where we participate and discuss things. And we also split people up into the small groups to work on projects together. And the course is designed for working professionals. So the lectures take place in the evenings, or if they're during the day, then you can watch them back on Teams and participate in the chat stream on Teams to engage with people. We have me as the main lecturer for the course, but also have other lecturers from our department in information science and the medical school. And we also bring in outside lecturers from the sector. This is an example of one of our papers. So this is Digital Health 701. And I'll just show you how we go through the content week by week. So they start off with an introduction to digital health. Then we talk about health information systems and how we can use health data for improving healthcare. Then we talk about interoperability of digital health systems, so how they share data with each other and connect to work together. We talk about international and New Zealand digital health standards, ethics, security, privacy and trust. So that's by Dr. Tanya Morenhout, and she is also the lecturer for the 707 paper that you can take as an option for the postgraduate diploma. In week 6, we talk about quality improvement, so how you can use digital systems for improving quality, and also cover the major New Zealand health IT projects. Then we talk about digital transformation and usability of digital health systems. So how you can get clinicians to use systems. Quite often systems are not necessarily designed with usability in mind. So we talk about how you can do that. We talk then about digital health innovation and theories of informatics. And that's when Dr. Angela Lim gives a guest lecture on how she set up her company and how she developed innovative idea in digital health. Then we talk about digital learning and global digital health with a couple of really great guest lecturers there. And then the final few presentations and lectures are on recording, analysing, interpreting data, and how you procure and implement and project manage systems. And also we finish with the discussion of future digital health technologies. And at the final week, we have presentations from the students based on one of the projects that they've done as an assessment during the course. And so this is just a quote from Sarah, who's actually on the call now. So if you wanted to ask her any questions. I think we've had really good response to the course. So this is the first year that we've run it. We've just been doing the 701 paper over the first semester and then the 703 paper over the second semester this year, but they'll both run together in the first semester next year. But the students, I think, have really enjoyed it, and it's been great bringing in all the guest lecturers from around the sector to have discussions with students. So I will leave it there, and you can ask me any questions now if you like. Or you can get in contact with me there on my email, or have a look at our web pages as well. So it's just otago.ac.nz/digital health.